Hey, good morning. It is Sunday, March 15th. The Ides of March are here. We're going to do kind of a coronavirus question and answer because so many of you had questions yesterday. I want to see if we can get through some of those. But before we do that, I wanted Addison to be able to share your forecast with you. You can ask any questions there, and then we'll get started on the coronavirus Q&A. So next 7 days, how's it looking?
Groundhog Day.
Nah.
Repeating what we've been getting the past several days, unfortunately, Brandy, which means the allergies concerns are going to still be running rampant. And unfortunately, we're not going to be seeing any break from this warm, muggy air until next weekend when a cold front comes our way. But at least there is a light at the end of the tunnel. Because you asked me this a couple days ago.
That tunnel's really long, though.
I know, but it's coming. Just hold on.
I'm trying not to glare at Addison because I don't even really get allergies most of the time.
Same, yeah.
But in the past couple of days, I can feel my eyes burning, they're watery, I'm sniffling and sneezing a lot, and
same.
people are so on edge right now about any kind of sickness or ailment that I feel like if you sneeze, someone almost wants to like put a tarp around you and isolate you. But
yes.
For a lot of folks, it is just allergies.
Just allergy concerns. We have the pollen count running exceptionally high for the tree pollen. So that is the big culprit right there of all of our woes and miseries with these allergy concerns. We will be dealing with this warm, muggy air for the next several days, unfortunately. Temperatures trending into the 80s more times than not, like we have been. And we don't have a chance to really cool down overnight. We're talking about 70s for those overnight lows. Meanwhile, that should be the normal high. So we don't even get a break during the overnight hours. That air just kind of sits around. The pollen sits around as well. It's been building up every single day. But once we get a cold front to arrive by Friday's time frame, a big amount of rain for Friday into Saturday, that's when we should finally see some changes come our way. But before that, yeah, sorry.
What you've described to me is basically like a big, warm, pollen-filled blanket that's just wrapping us up right now.
Can't let us out.
That sounds so fun.
Just wrap them. You're like, please let me go. No, pollen's got you.
All right, Addison's full forecast is on KHOU.com/weather. If you want to check that out, Addison, thank you.
Absolutely, you got it, Brandy.
You're clear. Run for the hills. All right, now we're going to talk coronavirus. We have so many headlines and developments to cover. We have a live blog. Our web team is constantly updating it with new information. So a couple of things to know. Matagorda has its first presumptive positive case. Brazoria County has a couple. There are new cases in Houston, Fort Bend. We have all of that information on KHOU.com. But I wanted to start. Ciara, did you guys have tag board pulled up? No. Okay. Well, never mind. We're not going to do it that way, I guess. But I wanted to run down some of the questions that we've been seeing from you guys to start this off, and then I'll jump in and try to answer questions where we can. We have written so many articles. We have talked to so many experts. We have all those resources available for you on KHOU.com. One of my tips and tricks is to just type into Google KHOU, coronavirus, and then a couple keywords related to whatever. I will not guarantee, but I will say I suspect you will find an article related to that because our team is just working non-stop. So first, a question that came in through ZipWhip. ZipWhip is, well, we call it ZipWhip. You guys don't call it ZipWhip. It's a texting program. So you can text us your questions and we can answer them. The number is 713-526-1111. That's 713-526-1111. You can text keywords as well. If you text facts, we'll send you everything we have on coronavirus. If you text weather, we'll send the forecast. Traffic, we'll send the latest traffic updates. Right now, I'm going to focus mostly on the questions that are coming in on Facebook, though. So just starting with these ones, and then we'll dive into some of your questions. So the first one was, what are the symptoms of the coronavirus? The three things you really need to look out for are fever, cough, and shortness of breath. If you are feeling any of those things, you need to call your doctor. Call your doctor. Do not go in because then you're putting other people at risk if you do in fact have the coronavirus. So call your doctor. Your doctor will be able to tell you if you need to come in, if you need to be tested, where that testing would happen, any of that. If you don't have a primary care doctor, that's another question we've gotten a lot. Call your insurance and see what the best course of action there is. The next question, I get seasonal allergies and recently started feeling congested and a cough. Should I get tested? We have a great article outlining the differences between allergies, where it's more like itchy eyes, itchy throat, congestion, that kind of thing. The flu, which has more body aches associated with it, and then coronavirus, which is fever, cough, shortness of breath. If you start feeling those coronavirus symptoms, specifically like fever, shortness of breath, that's when you need to call your doctor and set that course of action going. Someone asked, where can I get tested to make sure I don't have the virus? Here's a point I want to make here. Unless you're feeling symptoms, you don't need to be tested. Right now, there's a pretty limited amount of testing that can be done. The city's working to change that. Mayor Turner says he wants to bring in drive-through testing as soon as possibly next week. It's not set up yet. There are still limits. So they're testing people who are symptomatic, and even then, there are some other factors that doctors are looking at. Someone asked, where in Matagorda County does the woman with coronavirus live? In any of these cases, we often don't get those details. In some isolated cases, health experts have let us know. For example, the gentleman in Montgomery County who went to the rodeo because they wanted to give people a heads up. But in this case, we don't know exactly where the woman in Matagorda lived, only that she's a 60-year-old woman who came in with pneumonia, which was a side effect of coronavirus. It's kind of weakened her system. And this is a question that came in this morning. Would wearing gloves help you from getting the virus? Also, can you get it from people that have no signs or without ever being sick themselves? The issue with wearing gloves is that coronavirus is transmitted through droplets, coughing, sneezing. So what you really need to be on the lookout for are your eyes, your nose, and your mouth, your mucous membranes, because that's usually how the virus is going to get in. However, we talked to Dr. Alvarez a couple days ago, and he reminded folks to keep your hands moisturized. You're washing so much, right? Your hands are really dry. Well, that can crack your skin, and it creates another portal for the virus, not just coronavirus, but really any virus, bacteria, bug, anything. The second part of that question, can you get it from people who don't really have symptoms or aren't sick themselves? The answer is yes. That's a big concern. That's why city and county leaders say they shut down the rodeo, because 80% of cases are mild. In some cases, so mild, people aren't really feeling symptoms at all, and all they're doing is passing the virus from one person to the next. And younger folks aren't hit as hard as folks in the older generation, like 50 and up, is more the risk group. But say you pass it to someone who has a grandparent living at home, or a young child. That's where the concern lies. Okay, so those are the questions that came in this morning on ZipWhip. Now I'm going to pop over to Facebook and see what we got for you. Okay. And I turn my volume down so you won't hear me screaming at you when this comes on. Oh, Renee, okay. Here's another message I want to send, and it was something I tried to hammer home many, many times yesterday. I really want to emphasize it again today. The message from local leaders is live your life, just do it cautiously. Be aware that there is the potential for spread or transmission of this virus, but live your life. You don't need to panic buy. You don't need to raid the grocery store, because this isn't a severe weather situation, so we're not going to lose power. We're not going to lose water. The stores aren't going to close. If you need something in a week, you're still going to be able to get it. So please keep that in mind. Also be aware of your older friends and family who are the folks who are at risk, so you can go maybe get groceries for them. Just check on them. Make sure they're doing all right and they have everything that they need. Okay. Mandy asks, how long do we social distance? People have to work. I get it. There's no real timeline at this point. The city, county are encouraging folks to work from home if that's possible. But the idea of social distancing is to prevent the spread so there's not this overwhelming hit on the healthcare system all at once. This isn't going to stop the virus. That's not the goal. The goal is to mitigate it and what's called flatten the curve. We talked about this a little bit yesterday. So if everyone gets sick at once, right, there's this giant demand on the healthcare system, and they just don't have enough ventilators, not enough beds necessarily to care for everyone if we were all to get sick at the same time. So the idea with this is if we can limit our exposure to other people, sure, we might get sick, but it's going to slope a little bit more. We have an article on KHOU.com about that that illustrates it a little bit more. Oh, someone said repeat the phone number, please. So to text in questions, that's 713-526-1111. What I really want to encourage you to do, this is going to sound weird, save it in your phone as just like KHOU. You can call it anything you want, like your favorite TV station, maybe, I don't know. Because you can text us about anything. If you're watching our newscast and have a question or a comment, you can text us. It goes in the same place. If you want specific keywords, you can text facts. For all of our information about coronavirus, you can text weather, you can text traffic. Around the elections, we had results, which would give you a full link to all of the election results. It's a really cool tool that lets us kind of interact with you. And some of you have texted, and I've responded. Generally, though, folks are just looking for those links, and it's so easy because it's on your phone. I also want to mention, this is not really coronavirus related, but in severe weather events, if you can do it safely, if you can send pictures and video, that's an easy way to do it. Deborah says, I haven't been to the store in a few days because of the lines. When I did go, people are saying the price of food is going up because of the shortage. Can they do that? Price gouging is illegal, but there are some pretty specific parameters for that. If food is going up, it's not going up astronomically. Like we saw some people offering hand sanitizer on Amazon for like $30, $150, stuff like that. That's price gouging. There is the potential that things cost a little bit more because that's how supply and demand works. The thing is, there's not a shortage of supply. This stuff is all being stocked again, so it's not like we're running out of water. We're not running out. Let me just say this: we are not running out of toilet paper. Toilet paper is unnecessary in relation to a response for coronavirus. The CDC says you should only stock up on food or necessities if you're caring for an elderly relative. Otherwise, like I mentioned before, get what you need this week. And I get it. A lot of you have kids who are home from school. They will eat you out of house and home. You got to fill up that cart. But think about what you're going to be using and if it's just going to go to waste and if it's going to go bad. Just leave some for your neighbors because there are a lot of people. Mayor Turner made a great point. First responders who have been, working nonstop. They work weird hours. They haven't been able to go to the grocery store. They finally get there, and everything is wiped out. So get what you need. Leave the rest for your neighbors. Sorry, scrolling through. Gabriel asked, at what point do we have to close everything down? That's not something that's been floated right now. There are rumors online about a lockdown. There's no indication that is under consideration. Now, President Trump has talked about limiting travel just because the contained environment of, say, an airplane is a really great way for a virus to spread. But that hasn't happened yet. There is travel limited to some European countries to limit the transmission between there and here. But in the U.S., we're not seeing anything. Carla asks, why is everyone taking the toilet paper? That is a great question, and one that we asked licensed professional counselor Bill Prasad earlier this week. It's a psychology thing. There's a lot of confusion and a little fear mixed in with these headlines that you're seeing related to the coronavirus. So humans, our response is, well, I have to do something, and that thing doesn't necessarily always make sense. So we'll buy toilet paper. And then there's a copycat mentality. He's buying toilet paper, so he must know something I don't. I'm gonna grab a couple too. And it just goes on and on. There were rumors that toilet paper is made in China and we're gonna lose out on supply. No, a lot of it is made here in the US. There are mills in like Georgia and all over the place making new rolls for you so you don't have to worry about it. Again, if you have your kids at home, this week you'll probably be going through a decent amount, but you don't need to buy like a minivan full of toilet paper. Sandra says, keep kids at home. This isn't a vacation. Don't let them go to the movies or visit with friends. That's the reason they're not in school. It's something to consider. Social distancing really is just about keeping yourself away from other people who could potentially infect you, because coronavirus is spread by droplets. So if folks sneeze or cough, or if that is lingering somewhere where you are, and if you're in a closed-in area, something to think about. But parks, get your kids out and let them run. Stuff like that is an option. I know it's not ideal. Talking to a friend earlier, she has 2 young kids, and it's hard to keep them entertained, especially for a week. And you don't necessarily need to keep them inside, but you also can't send them to the zoo. You can't send them to Space Center Houston. Those are all shut down. So maybe be thinking about activities they can do outside. Board games, time to bring them back. Introduce your kids to all your favorites. I realized it's almost a year ago now, that I had failed as a parent and my kids hadn't played Clue. So if your kids haven't played Clue, introduce them to it. It's one of my favorites. Sarah says she's been seeing, it disappeared. Sorry, the Facebook feed, as people ask questions, it pushes the other ones out of view. So I am so sorry. Let's see. Shelly says, I quit doing my nails. Even the owner said no one is doing their nails. I did go yesterday and got a pedicure. I watched the staff disinfect the chair after each person got up. But you want to think about how close you are in relation to people, because you're supposed to keep about, a 6 foot distance, and that is less than. So it's thinking about the risk there. The nail salon was empty, I will say that.
Latoya was asking, should she go to work?
Latoya, that's a call to make to your boss. Every employer is going to have a different response. I know here at KHOU we've made plans. Other organizations have too. Amazon is telling folks to stay home. Big organizations, when they can. There are jobs that don't allow that though. And so it's something to have a conversation with your supervisor about, to be sure, especially if there's a lot of work with the public. If you do have to go into the office, just keep a distance. Maybe don't congregate in the break room with a bunch of people. Try to sit separately if you can. And I know some of that stuff is just not possible in some scenarios, but that's what we're trying to do. And this is, how do I want to say it? Again, this isn't going to stop the spread. The idea is just to mitigate it. So we're trying to cut down on our interaction, because if we have less interaction, the virus is going to spread less quickly, and we won't have that surge in demand for the healthcare industry. Does that make sense? Does that make sense, Ciara?
Yeah.
Sometimes I say things and I'm like, I don't know if they're coming out right, because this isn't scripted. Obviously, I'm just answering your questions based on what we've heard from experts, from doctors, from the government, from city and county leaders, and there are a lot of questions.
I'm on my depth, I can
Oh, okay. Sarah's going to get a mic on. Sarah asked, can it be transmitted by handling money? The virus can live on inanimate objects for about 3 hours, according to an epidemiologist we spoke to a couple of days ago. So potentially, yes. That's why you should be washing your hands. And I can't believe I haven't even mentioned this. We're how many minutes into this, and I haven't said y'all need to be washing your hands like crazy. Anytime you're interacting with something that you don't know is disinfected, wash your hands. If you can't wash your hands for 20 seconds, you're scrubbing for 20 seconds with soap and water. If you can't do that, hand sanitizer also works. The idea is still to keep your hands wet for about 20 seconds. There's a viral post out there that says you need to keep your hands wet for something like 3 minutes with hand sanitizer. That's not true. We verified, we talked to health experts. They say that's not true. Just about 20 seconds, make sure your hands stay wet, make sure the hand sanitizer's working, and you're good to go. Sergio asks, do you believe this is scare or fear-mongering, I think is what he's asking, or is this legit in your opinion? My opinion is to trust the experts, the epidemiologists at the national level, at the local level, who really do have concerns about this. That's what I do. That is my job. And they're telling us this is something we should be concerned about. They're not saying this. I don't want to use language that's scary. But they're not. They're not telling people to be scared about this. They want people to be aware that 80% of cases are mild, and in 20%, typically in older folks, 20% do lead to hospitalizations. But there are a lot of cases where people don't even know they're sick. The only challenge there is that you can pass it to people who potentially are more at risk. So there's been talk about the media and trying to scare people. That's not what we're doing. We're trying to disseminate the information that the experts, including the president, want you to know. And that's that this is something you need to be cognizant of. You can take steps to protect yourself and your family, but no one's forcing you to. It's just more a public common courtesy. Scrolling through. Lakeisha says, my husband and I were about to take a local vacation within the state. Should we still go? Again, that's entirely your call. If you were planning to go to like Big Bend, no one else is going to be out there. Lots of fresh air, probably good to go. If you were going to go to a play or something and you're in tighter quarters, you kind of have to weigh what your options are. But keep in mind, a lot of events and venues are closing up shop to help prevent the spread as well. Judge Lena Hidalgo said yesterday, this next week is really going to dictate how this is going to go. Because we've really pumped the brakes on so much, we'll see the impact of that. Also, as testing ramps up, there hasn't been widespread testing available, and now the city and county are really making that a priority, trying to get as many people as they can tested, but there are limits there. So as those changes happen, we'll probably get a really clearer idea. Keisha asked, is vomiting and weakness a sign or a symptom of the coronavirus? It's not. That really sounds more flu-y, especially body aches. Those tend to go along with the flu. Coronavirus is more respiratory. So you're talking about a cough, shortness of breath, and a fever usually accompanies it. We have an article on KHOU.com, super easy to find. And I think, Ciara, have we shared it?
Yes.
Okay. And it's shared in the comments as well about the differences between allergies, the flu, and the coronavirus, because there are some similarities, but there are some symptoms that really make them stand out. Body aches, gonna be the flu. Most likely. If you have itchy eyes, itchy throat, that's going to be allergies. But that fever, cough, shortness of breath, those are indicative of the coronavirus. In that case, if you were to suffer those symptoms, first step is calling your doctor. Don't go in. Call first and let them know. Marcia says, so sick, stay home? Yes. Anytime you're sick. It doesn't matter what you have, really. I mean, maybe the allergies, you're fine. But if you have the flu, if you have a cold, if you think you might have symptoms of the coronavirus, stay home. Always the best course of action. Ryan says, what if you're starting to feel symptoms and can't work? If you're starting to feel those symptoms, you need to call your doctor. First thing, call your doctor. There's also Ask the Nurse call center that Harris County Health has started up. We have that information on KHOU.com. I can't remember exactly what the number is off the top of my head, but we do have it. If you search KHOU Coronavirus Call Center, that number will be in a link there. Christine points out hand sanitizer with at least 60% alcohol. And that, yes, that is an important distinction. And most do have that. There was this weird social media thing going around last week about using alcohol, just pouring straight alcohol on your hands. It has to be more than 60% alcohol. Also, doctors advise against that. Dr. Alvarez, who we spoke to a couple days ago, because there isn't any moisturizing element to it. At least hand sanitizer, it should moisturize a little bit. Pouring straight alcohol is just going to rip up your hands, essentially. And then you're going to have to do extra moisturizing to prevent your hands from getting cracked. Taryn, amen. She says, here's a thought, doctors know more than your Reddit and Discord threads, or than your uncle who's sharing that meme on social media. Yeah, I have them too. Family members whose posts I've had to report because they're sharing misinformation. Really use that critical eye when you're seeing these posts. What's real, what's not? Do a quick Google search. If you can't find a legitimate news source that is sharing that information, then it's probably not accurate, and it's not good for you to share it and expose more people to that misinformation, because a scary amount of people don't take that step. Just Google it. Google it, see if there's a news source you trust that is sharing that information. Jill asks, are they setting up drive-through testing areas? At this point, San Antonio is the only place that has drive-through testing. The mayor is working on bringing that to Houston. There are a lot of questions. They're trying to figure out where it's going to be. If it's going to cost any money, that's unclear. Congress just passed the House yesterday passed a coronavirus aid package that includes free testing. So testing would be free. The Senate still has to take that up. Senate reconvenes tomorrow, should pass that sometime this week, and then it'll all play out. So we don't know how much it would cost if it starts up before all of that goes through. So a lot of stuff that still needs to be worked out before drive-through testing is available in Houston. Ashley asked, do you think schools may close for a longer period of time? That's so hard to say. A lot of them are closed for a couple of weeks. And like Judge Hidalgo said, this week is really going to be an indicator for us. It's kind of going to be the turning point. We'll get a really clear view of how the spread is working as we get more tests in and people try to limit their exposure and transmission. A lot of people are asking about the schools question, and we don't have that answer. And I think that's frustrating for a lot of people sometimes, but we want to be really upfront with you. We don't have all the answers. We're certainly trying to get answers to some of those questions, and when we do, we'll share them with you. If you go to khou.com/coronavirus, you can see all of our coverage. You can also sign up for the KHOU 11 news app and sign up for notifications there. I should say download the app, sign up for notifications, and we'll send you updates. But I know a lot of people can be overwhelmed by that. it's certainly overwhelming on my end, and I'm trying to decipher what I should pass along to folks on social media, because sharing every single presumptive positive case can be overwhelming. I think that's the best word. So I'll continue to use it. It can be overwhelming, and it doesn't necessarily share the full picture, because as many presumptive positive cases are, there are a lot of people who have recovered. Just in the past couple of days, I've seen stories that our sister stations have done with folks who have recovered from the virus, and essentially their message is, be cautious, try not to spread it to other people, but you don't need to worry, you don't need to panic. And I really want to hit that home. This is not something you have to panic over. This is not something that should make you live in fear. If you're in an older age group, in the risk group, sure, take extra precautions. Maybe don't go into those large groups. Something all of us should do because we don't want to spread the virus. But it's something that older folks should do just because they're most at risk.
I have a question.
Uh-huh.
Alyssa wants to know, what's the official recommendation to daycare facilities?
Do we have that?
So I can answer that.
Go for it, Ciara.
All right. I know you guys can't see me, but so Alyssa, when it comes to daycare facilities, we don't have any official information on that. But most places, like gyms and whatnot, what they're doing is upgrading their cleaning supplies that they're using, as well as cleaning more frequently. So a lot of what you would see during flu season, spraying Lysol, wiping down door handles, making sure that toys are clean as well.
That is so worth noting. It's also worth noting that the city and county didn't demand that schools close. That is a choice that school districts made themselves. And it's the same decision that is being left to daycares. It's really up to you what you want to do. Kids are little germ magnets anyway. In the case of the coronavirus, it does not impact children. It impacts children. I want to say it impacts children, but they don't have severe symptoms, is what I'm trying to convey. It's the older groups that really have a reaction because their respiratory system is more at risk. Kids, for whatever reason, we've seen an incredible survival and recovery rate. So that's something else to weigh. The issue with schools really is thinking about anyone in those older age groups who can be exposed via the kids. Marcia asked, has the city or cities shut down all outdoor events? So the city and county only shut down city and county sponsored events. So anything that needed a permit through the city, that's what shuts down. Everything else has been voluntary. So when you look at the zoo or Space Center Houston, which just yesterday announced that they're shutting down for a little while, that's a choice that those organizations made. It's not mandated by the city. Yes, Joni says, as long as the children don't have health issues. Thank you for clarifying. Any child whose immune system is, well, really any person whose immune system is already challenged, this virus is going to be trouble for. So if you already have health issues, you're going to want to stay away from crowds as well. Yeah, kids are still carriers, so they infect teachers, parents, and grandparents. At the end of the day, I suspect that is a huge factor in why school districts made the decision to close. Someone asked about a kid who died from the virus. I don't know about that case. What I will say is there's tens of thousands of people who have gotten this virus worldwide. And we haven't heard a lot of instances of children having the worst impact. If you look at it statistically, it's older folks. That's why most of the care and concern is centered around them right now. But the goal is that we all kind of steer clear and put our best foot forward in making sure we're washing our hands, keeping personal hygiene up, because that's the best course of action. Yeah, Christina points out kids with asthma. Anyone who has a compromised immune system is going to be at risk. Alberto asked about a doctor who died in China. I'm not saying that no one who's younger than 50 has had complications from this. All I want to stress is that statistically, it is an older age group that is seeing the most complications. If you have health issues, especially anything respiratory, you're going to be at risk and really want to limit your exposure to people. Okay. Thank you guys so much for all of your questions, and keep them coming, because if there are questions that we don't have answers to, we want to make sure we're still digging to get that for you. So you can ask them here, but I really want to encourage you to text us. And so that number, I know Ciara shared it in the comments, but it's 713-526-1111. And if you text the word facts, I'm going to see if any of you have texted in. I can pull it up right here. Someone asked about Katie. We do know that a company released that it has a presumptive positive employee, and they're notifying people. Here's a couple questions from someone. They texted in. If the governor is saying not to panic, but say this virus is serious, why are they contradicting on what they're telling us? Panic isn't necessary. They're telling this they're sharing this information in the way they would if a system is brewing in the Gulf of Mexico, right? There's something that is potentially posing a threat. They want everyone to be aware of what you can do to prepare, if you can prevent damage. It's really about awareness. In this case, we know that this virus is out there. We know that it poses a risk to a certain group. We know that it spreads fast. So they want people to be able to take those measures to prepare and prevent. They're not saying, in this analogy, that a hurricane is sitting right off the coast and you need to go buy up everything you can to prepare. They're saying, get what you need, probably for about a week. You can go back next week. It's okay. Another question, do we still have to pay for childcare if our child is not in daycare? That's a private daycare issue, and that's a challenge. It's also, as an employer, something you have to decide if you're going to allow someone with symptoms to take paid days off, non-paid days off, PTO. That hasn't all been worked out at the federal level. Although it is addressed in this coronavirus aid package passed by the House that we're still waiting on approval from the Senate for. Are there any extra precautions people with asthma can take? And how do I know when it's not just an asthma flare-up versus the virus? I would say a call to your doctor and a fever that goes along with it. So those main three symptoms for coronavirus are fever, cough, shortness of breath, and I can see how a couple of those would be related to an asthma flare-up. Call your doctor, because they're going to ask if you've been traveling a lot, if you've been in large groups, anything like that. Precautions, I would say just try to avoid people. Enforce social distancing. If you don't have to go out, don't. Wash your hands constantly. Try not to touch your face, especially eyes, mouth, nose. That's where we're transmitting everything. That's how the virus gets in. So just really try to be vigilant about those things. Are we going to give a 4-week quarantine starting April 1st? Oh, this is what drives me crazy. A reliable source on Facebook. Has there been any other news source that has said so? No. Am I saying it is completely out of the realm of possibility and impossible? No. We're seeing other countries go into lockdown as a response to the coronavirus. It's happened. This is not something that is under consideration at this point. There's a lot of fear-mongering on social media, and I think when I see these posts about the media is spreading this fear, I really think a huge amount of it is social media. People sharing information that isn't legitimate. Just try to use that critical eye, critical thinking when you see some of this stuff. If no one else who is a valid news source, and it can be ABC, NBC, Fox, CBS, we're in a CBS affiliate, check with your local news organization, because I know not all of you are here in Houston. I really have to give credit to our KHOU 11 web team, also our Verify team, because they are working constantly to update information and make sure it's accurate. You're going to see that we're not always the first to report some of this stuff because we want to make sure it's right. Because there is no sense in instilling fear in anyone. The goal is about awareness. It's not a race. So find a news outlet that you trust, and you can use them to cross-reference some of the information that you see on social media. I'll do one more question if I can find one here that's texted in. Where can I find where and how many cases are in my state, county, and Texas as a whole? We do have that information on KHOU.com. We're trying to keep a tally. Keep in mind, that number is a snapshot in time. It is the most accurate information we have at that given moment, and it changes fast, especially as we ramp up testing, which the city of Houston and Harris County are working to do in the next week. You're gonna see those numbers change. I'd recommend you download the KHOU 11 News app and sign up for those notifications, because we've been pretty good about pushing that information out. But it's hard right now to get a firm, accurate count. You can get kind of an estimate of where they've been in the past day or so. But go to KHOU.com. Again, we're updating these blogs anytime there's new information locally, in the state, nationally, internationally, so you can kind of track it back and see what the very latest is. And those are usually at the top of KHOU.com/coronavirus, or any more on the front page of KHOU.com. I really appreciate all of you guys joining in on this conversation, and I've seen so many examples of answering each other's questions. Thank you. The goal is to make sure we all have the facts that we need to be aware of this and take any preventative action we need to, not to scare folks, not to intimidate folks. Just live your life, but do it cautiously. Have a good day.